Dr. Mads Gilbert, a professor of emergency medicine at the University of Tromso in Norway, but he has worked and trained Gaza's doctors for the past 20 years. Mads, thank you so much for your time. I mean, the numbers, the figures themselves are staggering, but they're only numbers. But at present, this is from Doctors Without Borders just last month. More than 100,000 people are wounded in Gaza. 14,000 at least require medical evacuation. Only 17 of Gaza's 36 hospitals are functioning, and only partially. What is going on here?
Well, there is absolutely no doubt what's going on. It is an ethnic cleansing of the worst type. It is a genocide directed against the Palestinian people. We have known this for more than a year now, and I am sick and tired of discussing every day on the news the details of the Israeli atrocities against the Palestinian people. I am a medical doctor. I am trained not to treat symptoms, but to find the root causes of pain, of ill health, of disease. And there is absolutely no doubt what is going on here. The root cause is the occupation of Palestine. It is the ambition of the Israeli government to annex Gaza and to expand Israel across the West Bank, maybe into Lebanon, definitely into Syria. And in that, they are attacking the healthcare of the Palestinian people, because healthcare is vital to any community to feel safe. They think they can actually demoralize the resistance in Gaza and in the West Bank by attacking the hospitals. And as Ashraf said in the report, there is no doubt that they want to empty North Gaza, and to do that, they need to shut down El Auda, Kamal Adwan, and the Indonesian hospital. And the shocking thing is that the world leaders are sitting idly by and watching this live taking place day by day. And now North Gaza has been under siege for 80 days. They have had ample time to stop Israel, and that is what needed. There is no need for more field hospitals or drugs or bandages. We need an immediate ceasefire and an immediate lifting of the siege of Gaza.
Mads, you've really hit the nail on the head there, because rather than giving a medical diagnosis for the suffering of Gaza's people, you say it requires a political analysis because of Israel's actions. But that doesn't help the doctors in Gaza. It doesn't help the patients. It doesn't help the people who are using hospitals as safe havens. They need immediate attention. When do you expect them to start dying of starvation and lack of care? That's already happening, of course. We know that people have been dying on hospital floors. But that's presumably only going to get worse, because if those hospitals in the north close, there's literally nothing for people there.
You're absolutely right, but allow me to disagree that what helps the doctors and nurses and paramedics and the patients of all the Palestinian hospitals and primary healthcare clinics in Gaza now, it is ceasefire. It is an opening of the siege, and it is possible if the world leaders read the US government and the EU government, put enough pressure on Israel, cut the weapon supply, stop funding them, stop politically supporting them, there will be a ceasefire. But they are only backpatting Netanyahu and his fascist gang, that government. So I think for all doctors in Gaza, what they would welcome now was an immediate stop in the bombing and turn on the water and the food and the medical supplies. And you're right, they're dying. Last 24 hours, the Israeli occupation army killed 50 people in Gaza and injured 86. I am an emergency doctor. I know what it takes to handle 86 wounded, many of them children and women. And the medical system in Gaza cannot accommodate that. And we're only talking about Kamal Adwan, and we need absolutely to support Dr. Hussam Abu Safi and his very brave staff there. It's become a symbol. But don't forget the Gaza European Hospital, the Nasser Hospital, the Al-Aqsa Hospital. All of them are under immense pressure and receive 10th and 10th of injured every day. I mean, the situation in Gaza now makes Dante's Inferno look like a tea party. And I was appalled 2 weeks ago when more than 50 heads of state got together in Paris, not to discuss the situation in Palestine, but to celebrate the reopening of the Notre Dame. When there is opportunity, there is will. When there is will, there is opportunity. But it seems there is no will to come to the support of the Palestinian people. And it's a shame. It's a complete moral breakdown, both in the Arab world and the Arab leaders, and not at least in the Western world and among the Western leaders. We said in 1945, never again for anyone after the horrible Holocaust against the Jewish people. And now it's happening again. And we are discussing how we can do some details to amend this. It's impossible. Today is Christmas Eve. I cannot say Happy Christmas this year. It is not possible. What we all need to do now is to stand up and say, stop it, because we are in the middle of the history books now. We are watching live a genocide, which is horrible, and it must be stopped. Stop talking about medical supplies. Stop talking about small details. We need, for your president, your prime minister, for my president, my prime minister, we need them to take brave action now, because it is possible to stop Israel.
Mads, thank you very much indeed. Look, you're absolutely welcome to take it into any direction you want. And if you want to talk about the politics of it, of course we can. But we need to have the decision makers listening, as you say. Merry Christmas, if it's even possible, Mads. Take care.